Hello, friends. Melissa here, talking to herself all alone in her bedroom once again. It's Thursday night at 7 o'clock. It's time for Ask Melissa Anything. Tonight, it is an open line. We'll take whatever questions you have. I'll answer almost anything. Believe me, there are things that we can talk about that are not always the most comfortable topics, but since I do some women's health, that stuff might be on the table. Let me grab my water. I decided that the first week we did this from my desk, and doing it from my desk really limits my ability to move. And since I need to be able to move, in case you have a question about an exercise or emotion, I'm on the floor. So if you're joining us, please type in the chat, tell me that you're here, say hi. I had the privilege of watching my friend Megan this week do an unboxing. She owns Colorado Baby, which is the cutest baby store in Grand Junction, Colorado. And I just laughed and enjoyed myself watching her open a box. Like, who knew that could be so entertaining? And yet, with this shelter in place and isolation, I miss all my friends very, very much. That at least my faraway friends that I'm used to seeing online are still there. So I will start out with a couple stories while hopefully some of you are joining in. Again, if you have any questions about things that hurt, things that ail you, please type them in the chat. I will do my best to answer all of them. I'll also make sure that I've got my laptop over here. Hi, Liz. You guys, Liz is somebody I would see normally almost every week of my life, and I miss her dearly. I miss her sweet voice. I miss hugging her. I miss sitting behind her in church and her husband giving me mints. I miss little things in life. I'm telling you, I need this to end so that I can see the people I care about. And believe me, she is one of them. So Liz, thanks for joining tonight. Of course, I'm trying to bring up on my computer. Since I'll just ramble here for a little bit while people are joining us, we started something fun today on Facebook and on Instagram. So if you're more of an Instagram user or a Facebook user, we're starting to post pictures of our team, quarantine teams. Posted a fun picture of Rachel today, so make sure you find that. Tell her hi, tell her that you miss her, all those good things, because believe me, I do, and I miss seeing her because she is somebody that I would see every day of my life. So, all right, so let's talk about... Oh, shoot, it left me already. So if you've got a question, post it in the chat. Gives me something to talk about, or you'll find that I'm rambling, and that's not any good. Let's talk about, I'm trying to think. So if you guys didn't know, we're kind of closed at Nephew. And basically that means that very little activity is happening. Most of the optional surgeries have been canceled. Doctors are doing... See, I get distracted by the chat. You're on my page. Does it look like this? Philip, I'm not sure where you're at. This should be the Nephew Physical Therapy Facebook page, and it should be live. So I see you up in the corner here like you're watching. So, but of course, I'm having some challenges with the internet here at home. So I'll just keep rambling. If you guys got a question, put it in the chat. I'll do my best, like I said, to answer it. I sure hope that I'm in the right place. And again, this is how technology goes. It's kind of uncomfortable too. So right now, treating post-surgical and kind of some acute injuries right now. And it's really unfortunate. If you get hurt right now, what a challenge it can be. I actually took a random phone call at the office. And of course, it's a one-man show right now. It's me, the office, and whoever's coming to visit. I happened to pick up the phone last week, Wednesday morning, and talked to somebody who'd found us on Google who had sprained his knee. Now, this is the funny thing. When God gives you challenges and aches and pains, you can relate to others. Or when you have a husband who separates his shoulder, hurts his back, or sprains his knee playing basketball, you can relate. So this poor guy, I'm going to cough, right? At home, doing some home stuff, tweaked his knee. And it didn't sound good. So gave him the option, we can either get him in, which, as a reminder, you can go to physical therapy without a doctor's order. It's one of those little secrets that's not a secret anymore, except for most people don't know. You do not need a physician's referral to go to physical therapy. Now, that being said, we still want to connect with your primary care physician or orthopedic doctor, depending on who you're talking to more. But you can just call us and we can get you in. We know how to play the game with the insurance. We know how to figure out all those things. And so that sometimes saves people a step and allows them to get the help that they really need faster. But this guy didn't sound so good. And I was like, well, I could either get you in, but I knew that our local orthopedic place was open Monday, Wednesday, Fridays. So if you're in Holland and you're stuck, I know that Shoreline Orthopedics is open for urgent cases. Well, he got in, bad enough, got the MRI. Thankfully, nothing major. But this poor guy, right in the middle of being stuck working at home, sprains his knee. So we're slowly restoring motion carefully. And that's why the challenge in giving verbal exercises across the internet, which I've always not been the biggest fan of, is that I don't get to touch you. So can I give you exercises here, some basic stuff? Yes. Go to our video last week. We did a lot of great things for neck extension and back, how to fight bad posture. But it still eliminates the opportunity to put my hands on you. So can I show you some basic exercises for the knee? Can I show you how to stretch your calf? Can I show you these different things? Absolutely. The challenge I have as a physical therapist is sometimes stretching isn't enough. And so in this particular individual's situation, yes, we needed to restore motion in the knee, but some of that just requires getting in there and giving those muscles some TLC. If you've been a patient of ours, you know getting in there and massaging isn't always the most fun massage. And often we hear, I had no idea it would feel like that. I had no idea it hurt there. Well, that's because your body's starting to compensate. It may not be your primary pain, but your muscles letting us know. So anyway, I'm talking about one of the individuals that we're helping in the middle of this pandemic with this shelter-in-place order. If you're joining us and you have a question tonight, I invite you to put it in the chat. Otherwise, I'm just going to tell some stories tonight and talk about a couple of things that we've run into. Next week, we'll do a specific topic again, but I wanted to do an open line tonight to address something if you're from home. And I may use a couple of questions I've had from some friends lately, so we might answer those here. So again, poor guy, sprains his knee, needs to get straightened out, all those kind of things. So that's where knowing where to go is sometimes half the battle. When you hurt yourself, who do I call first? I hear that often. And sometimes it's your primary care doctor, sometimes it's your physical therapist, and sometimes you need to go directly to the emergency room or urgent care. One of the things I have learned about orthopedic injuries, which is the world we function in, muscle, joints, bones, all that kind of stuff, is as a parent in our community, again, this is for those of you in West Michigan, did you know that Helen DeVos Pediatric Hospital has a urgent care walk-in bone fracture clinic Monday through Friday? Now, I don't know if that's still true during this time, but when your youngest son falls off the monkey bars and lands on his wrists and you think it's just a sprain, but he cries all night, I wish I had that first morning driven downtown instead of to the emergency room, because they could have x-rayed it and figured out right there that he didn't need a cast. So that's a really, really good tip to know when it comes to who do you call. So knowing those resources, talking to your friends, of course, asking for those recommendations, really, really important thing. So Philip, thank you for your questions. Philip's wanting to know, while running, suggestions on how to reduce right hip discomfort. Sometimes his feet, sometimes foot discomfort, feet discomfort, and runs as well. Okay. Oh, and I can see up in the top here that my friend Heather is joining us, and I see Hannah's here. I'm trying to look at all your pictures to recognize you. So, Heather, talk about those tight hip flexors, right? Okay, Philip, this is such a great question. One of the challenges that we see, hello, Renee, thanks for joining us. We're talking about running or walking with right hip discomfort. So I'm going to make the assumption here, Philip, that you're like the rest of us and we're too tight in our hip flexors. And so stretching out the front of that hip is probably one of the most important muscle groups that we don't stretch. Runners notoriously stretch hamstrings over and over and over again. But when you think about how the hamstring works, which, okay, again, now on the floor, guys, hamstrings, back of the thigh, that hamstring really works to slow you down. And so stretching it out more and more actually can destabilize your hips and pelvis. So if you didn't already know, I'm a big fan of the glutes, and we need those to work. But the glutes, let's see, how do I describe this and how do I show this? I'm about to get up and start moving, so let's see how this goes, and hopefully you can see me. What we need is the front of that hip to open up so that we can go forward. All right, so let me show you here. All right. Can you see all right? I hope you can. Let me see if I can tilt my phone. Of course, you know, very fancy technology here in the Meiste home. My cell phone is up on the hamper. But hey, we're learning, right? Okay, so to stretch that hip flexor, I'm gonna go into a half kneeling position, okay? So I'm half kneeling here, Philip. Now, this muscle, which runs along the front of the thigh, is one of the hardest ones to stretch, and it won't feel like a normal stretch. But to get it to stretch really requires a good butt squeeze and a slight push or slight movement forward, okay? And so when I do that, I'm gonna feel this part open up. That is the goal. But I'm not lunging way forward, I'm not leaning back. I'm doing this motion because when I'm running, if I wanna get those nice long strides with running, if I'm gonna step and go forward, let me do it this side, step and move forward on this side, I really need to have the front of the hip open up, okay, to get that glute to contract. So really, if we're talking about a hip that's not working well, we often start out front to back, okay? So it's the front of the hip opening up, all right? Then we need that glute to engage. And so notoriously, we just don't use our glutes as much as we should. We all sit too much. And so in last week's video, I suggest you watch that. That shows us how we do some extension, which also opens up your hip. Doing that will help. The other thing about runners is they only go forward. And because you guys, if you're a serious runner or even a casual runner, runners just go straight forward and they don't do enough side-to-side strengthening or rotational strengthening. So usually when we're talking about running, what I suggest, besides the hip flexor stretching, is you're gonna wanna make sure you're getting butt, gut, and hamstrings stronger. So that's gonna include planks, okay? You're gonna wanna do those planks. Very hard to do, but that will engage those three major muscle groups of the butt, the hamstrings, and your lower abs. Get those to engage. And then we need sideways motion, which the challenge with strengthening sideways, moving side to side, is that, again, your body will compensate. So, the most common exercise, again, I'm not sure if you can see me very well here, so I'm working on, adjusting my camera height so that it works well here. So, fancy technology. Again, patience with me, folks. Patience. That's not working. You can laugh when you watch this on YouTube later because it's just not quite what I want it to be. But, hey, we'll get it figured out. So when you're doing sideways motion, goodness gracious, I don't think I know what's the problem. It's too high. Let me get a little bit lower here. I can adjust this. Right? Again, fancy technology. Adjust it down here. There we go. There we go. That's what I needed to do. I forgot what I did last week. Okay, so lateral motion. So most commonly, people think of doing a leg lift. I'm not opposed to the leg lift as long as your foot is not in front of your hip, okay? So if it's forward, you're gonna use that hip flexor again, all right? When we're testing it, we need to make sure that that hip is behind and then you go up. But if you go too high, again, you're using the front of the hip or the back. So what we like to do in therapy is a clamp exercise. And we would add a band or a resistance around the knees, but what we'd be doing is separating our hips apart. When you add that resistance here, it starts to get some things opened up, okay? So that gets some good outside of the hip strengthening. So there's that. There's also standing. You can see me back here. Standing lateral motion. Again, the key to this is not going crazy, all right? It's just small little motion. So you're working both sides of those hips. but it's isolating that. So a few tips there for you for runners that say, oh, running or doing that before or after. Good follow-up question, Philip. So I would suggest, now that I'm on the floor, let's get this figured out. Oh, I'm just remembering what I did last week. Way easier. Okay. I kind of don't care, to be honest, as far as stretching goes. I think it's good to do a maybe 1 or 2 minute walk warm up just to get your muscles going. But personally, I am probably more of an advocate for stretching afterwards, which is that hip flexor stretch. As far as the strengthening goes, that's just something you should do as a regular part of your weekly exercise routine where you're spending time strengthening your butt and hips 20 to 30 minutes a couple times a week. Or planks every day, which is one of the reasons why I miss the team, because I'm not doing planks at lunch every day. It's kind of a requirement at Nephew Physical Therapy to eat your lunch. You have to do 5 minutes of different forms of planking. So 2 different things. If you're going to stretch, I highly recommend spending time stretching out afterwards. I'm okay if you stretch your hamstrings out afterwards if you stretch everything else. The front of the thigh, your hip flexor, your calves, you do all those things. But if you're doing the strengthening, that's just something you're going to do periodically throughout the week, where you're going to work on bridging, squats, a variety of different butt strengthening exercises, going forward and sideways, just to build up that hip. And again, we talked about tummy time last week, spending time here, squeezing and engaging those glutes, opens you up, which in general is what's getting most of us in trouble anyway, as we sit way too much. And then we start to feel that, I feel it in the front of my right hip. That's where I'm tighter. So that area as well. So try a couple of those kind of things, but it's really about the long game here. And it's not a simple thing about, okay, longer stride length or your cadence. And yes, sometimes making adjustments to how people run is part of it. But I like to think of strengthening or stretching exercises, whether it's in the context of rehab and physical therapy or just in the context of exercise in general, is it's like practice. It takes me back to 7th grade girls basketball, where all you wanted to do was just scrimmage each other because it's way more fun, except for you don't know how to play if you haven't shot 100 free throws and done passing drills and dribbling drills and all of those things, because basically those exercises we're talking about is drills for game time situation. You're strengthening your glutes, so when you go to use them to climb stairs or run, they know what their job is. You're stretching that hip flexor that allows that hip to open up so that your glutes work better. So in a game time life situation, they're working much better. And so it's hard because I often joke that physical therapy, or, well, we'll just say physical therapy exercises, can be very boring. It's breaking down or isolating that muscle to true isolation so that we're not compensating with all these other muscles we've learned to compensate with, the back, or if you have big calves, or all those kind of things. Like there's different things that we look for when we see somebody, right? Runners who have giant calves often have tiny glutes, and that can be an indicator that there's an imbalance, because we really should have bigger glutes than we do calves. So that kind of idea where you go, I'm going to stretch afterwards. Do, again, a minimal amount of warm-up, whatever you need to get going. It depends on the temperature too, right? If you're in the south like you are and it's 50, 60 degrees, maybe you don't need to warm up as much as it is here in Michigan and it's in the 30s. So keep those things in mind, but part of it is the stretching. I highly recommend stretching out the hip flexor and then working on some glute work. So thanks for that question. Try it out. Let me know how it's going, and if future videos we actually need to do a series of butt strengthening exercises, we'll do it. So that would be helpful in prepping ahead of time, and so we can come up with some exercises. Renee has a question for us. How do you know if you have a torn meniscus or pes anserinus bursitis? Ooh, I like this question actually very, very, very much, because what if it's not either? What if I don't necessarily think it's one or the other? So the pes anserinus, since she asked this, is, okay, sorry, home internet, almost lost you guys there. Okay, I was talking about the pes anserinus, which is a group of muscles that come down the inner thigh and attach across the knee. All right, let me try to show you here. Basically right here. So it comes down and it comes right across and attaches right through there, okay? So that is a big kind of, and it attaches way down here actually, below the knee joint. And that's a little tender on me because it's an attachment. So my first answer is, I doubt it's bursitis. And the reason that is, if I go back 20 years to when I was in college, I remember being taught we as physical therapists will never see bursitis because it's really obvious. And if it's truly bursitis, the doctor's going to stick a needle in it and drain it. I've seen bursitis once. My grandpa, it's very tender, Renee. Yeah, let's talk about what you can do for it just a minute. Let me talk about the bursitis. Let me finish my story. So, I saw true bursitis once on my grandfather before he passed away, and it was in his elbow. And huge pocket of fluid just hanging off the end of that. And to address it, they stuck a needle on there and drained it. So often we get that diagnosis of hip bursitis or other things, but truly if that bursa sac, which is a sac of fluid that provides cushioning, is truly ticked off, it's going to be big and swollen, okay? So very unlikely that it is bursitis. Now, did you tear the meniscus? That's the next question. So one of the common signs of a meniscus injury is the locking of the knee, okay? Now the meniscus, which I have a patient right now who thought they had a meniscus injury, but thankfully they don't. Meniscus is, you have two kind of cups, we'll say, where the knee sits on it, and the bone moves through those grooves. One is oval and one is circular, okay? And what can happen is if you tear a meniscus, it can create a flap. And so those knees, they lock up and they get stuck in weird positions, and you have to force it loose, and sometimes you can't. And so we check those by kind of grinding your knee around to see if there's clicks, pops, those kind of things. It would take a pretty good mechanism of injury and trauma, probably to tear a meniscus. So what I want to say is it could be option C. So if you're really tender on the inside of the knee, and Renee, if you want to add a couple more details, that's fine. If not, it's okay. But we're talking about the inside of that knee, which is my husband, that's what he injured, but he injured his MCL, his medial collateral ligament, which is the ligament that stops motion on the inside because he went to plant and push, and the knee buckled. So since it's really tender in that region, first thing I would do is ice massage. So I like an ice massage even better than an ice pack, folks, if you have point tenderness, right? Specific area where things are sore and tight. The simplest and cheapest way is you buy those paper Dixie cups, which I don't even know if people buy those anymore, but you take a paper cup and you fill it up with water and throw them in your freezer. So then when you need it, you peel off the top of that paper and you flip it upside down, and now you're going to massage right on that area. Oh, Renee, so you did a squat and you just heard a pop. It didn't hurt right away. So it depends on how loaded it was. If you were doing heavy weights, that could be. It could have been just a tendon realigning itself. That's a possibility. There's a lot of different factors there, but if you are tender on the inside of that knee, first of all, you need to be icing, okay? So ice that down. And of course, this advice is given, this is my disclaimer on every video, my advice is given without me ever seeing you, touching you, or putting my hands on you. So no guarantees with anything that I say. We're talking about principled ideas, general things at this point. But for the most part, unless you have a significant circulatory issue, ice is going to be your friend. So you're going to make that paper Dixie cup, peel it off, and then you're going to massage that area. The thing about cold is it's going to go through cold, burning, achiness, and then it will go numb. And usually in about 5 minutes, because you're just going to hit that inside of the knee. You're not icing the whole knee at this point, right? Because you said you're pretty tender on that inside. So ice that down for 5 minutes. Now, what I learned this week with my new knee client is they were icing down and then doing a lot more activity. Please don't do that, anybody. If you ice down your shoulder, you ice down your back, you do any of that kind of stuff, don't then go for a walk. Yes, it will feel much better, but you won't know if you're ticking it off, right? You may or may not be doing any damage, but it definitely can be very helpful. So that ice massage in and of itself will be more point tender. and maybe even more beneficial than saying taking ibuprofen, which will circulate through your whole body. The next thing is going to be some form of rest, okay, and modification with activity. But when we're talking about that knee, the other thing to think about, Renee, in this situation is, do you have any loss of motion? And so that's where does it bend as far as the good knee, and does it straighten as far as the other knee? And so our first initial steps is to make sure that you have full range of motion. That's the other thing to consider. And if not, you can do something very simple called heel slides, and this will kind of let you know. So a heel slide, very simply, looks like this. I'll be back up here. You're here, you're pulling it up as far as you can go, and then you're straightening it out and putting it as flat as you can get. And so you go from one motion all the way up here. Now, the thing about the knee is it will like this, and then it will hate this, and then it will like this, and it will hate that, because you're going from one extreme to the other, right? But that range of motion, making sure that it moves as far as the good side, is also a good sign, okay? So again, calming it down, doing some good icing, resting, making sure that range of motion is there, because again, if you lose that range of motion, you're gonna be limping. And limping will throw everything else off, okay? So we don't want limping. We want normal range of motion, and then we want to exaggerate that heel strike, that you're hitting your heel on the ground first. It's one of the things I'm trying to work with my husband here at home. I'm not his therapist, but I am in this situation, and so trying to get him to walk as normal as possible to avoid hurting his hips, his back, those kind of things. So work on the icing, make sure you have the range of motion, and then at that point we start introducing gentle activities. We might need to stretch that calf out because that gets tight. That's one of the areas we see. Or we start working on the quad. We do gentle range of motion on the bike, and then progress from there. But in the initial stages, you're icing, you're doing range of motion, and kind of protecting that inside of the knee. So excellent question. Jen, thanks for chiming in about how helpful ice can be. So true. I've not always been the biggest fan of it until I've had tennis elbow come and go. And sometimes, tennis elbow for me totally is tied into bad posture, sitting too much, reaching forward, and it's shown up in volleyball. And I would go home and I would ice it down. I'm like, oh, this actually feels better. And then I always like to joke like, oh, so annoying that I actually have to follow my own advice. So Renee, you are so welcome. What a great question. I hope to see you back next week. I'm going to be here at 7. So we'll probably have some, maybe some specific exercises next week. But let us know how you're doing. Again, trying to get those things earlier. Sorry, Jen is making me laugh. She said she hated the ice at PT. But it does work. And yes, Rhonda, it's so hard when you've had an injury, or you've had surgery or something, and you kind of just want to move on. You're like ready for the next phase, which is where icing is always a good conversation to come back to. Let me mention this. So you can be making progress. And often we think icing is something we only do for the first couple of days after an injury. However, like in Renee's situation, if she tweaks that knee again, if she pushes sideways or it buckles, or she misses a step or loses her balance and she tweaks it again, it's like she almost has started that inflammatory process all over again, and you go back to the icing again. Again, one of the most effective ways to calm it down, which is the inflammation. Inflammation causes pressure because it brings extra fluid to the area. That pressure then decreases joint motion, okay? And that's why we notice with ankle sprains, all that swelling. And then don't forget, gravity is also a factor when we've tweaked or done something. And then it comes all the way down into your foot. And so it will accumulate. So we don't talk about compression a lot in the other joints besides the foot. But if you do have a foot surgery, a foot injury, an ankle sprain, compression is the other piece that goes with that. So icing is really good to address the pain, but compression, like an ACE wrap or a tight pair of socks, can be very effective for keeping that fluid from accumulating. What you will see is that wherever your sock ends is where all the fluid stops, but at least it's not restricting that ankle from moving. Let's see. Oh, Jen, you're so human. She's saying she's helpful for the reminder. This is the thing that I have also learned about working with people for the last 20 years, is that we fall off the wagon. While it is our job to work ourselves out of a job as physical therapists and teach you what to do with your body, how to take care of yourself going forward, we just forget. Jen, like, I forget that I have plantar fasciitis that shows up, and then I'm like, oh shoot, I know that if I do my squats, stretch my hip, do that stuff, I have no foot pain. And then when I don't, and I fall off the wagon of taking care of myself, I need to readdress it. So these reminders are very helpful on how we need to manage it. The challenge is when you can't get back on track, that's where we actually want our clients to come back to us. And usually it's not as long of therapy as before. I've seen that happen with some hip or back patients where we did, normal course of therapy, 4 to 6 weeks. Our average visit is about 10 visits is what we see people. And you get them better and then you send them back out into the world. Well, it might be a year or two, sometimes 3-4 years later, that back pain or that hip pain comes back. Or even sooner than that, they start pushing themselves a little further, which is what we're hoping for. And then the body identifies the next breaking point, so to speak. So we get those clients back into our office. They already know physical therapy works. We've already built the relationship, right, Jen? Which is why we miss our clients so much when we graduate, you guys. We then already know, they know that it's going to work. We have that trust. We can get right in there, get going right away. And then often sometimes that's only 4 to 6 visits instead of 10 to 12. We can really turn that ship around real quick, get them back on track, make sure they know what they're doing, and send them back on their way again. Like, it's the craziest, it is the craziest business model. I always joke, it's my job to work myself out of a job. It's our team's job to teach you how to better care for your body, which is why this kind of Thursday night Ask Melissa Anything is kind of fun. And it's fun to see you guys chatting. It's fun to see who's showing back up again. So that's really kind of a cool thing. So we've talked so far tonight about the need for icing. Compression, we were talking about that before I got distracted, and Jen made me laugh about falling off the wagon or needing those reminders, which we all do to take care of ourselves. But that compression, let's talk about that real quick. I do have a client right now who's post-surgical foot, had a couple of different procedures done. We're in week 4. We're in week 4 of this we're closed kind of season, where I've stepped back into working with clients again because we're just not busy enough and wanted to make sure that we're taking care of the team. Let them, stay at home at this point. And so when she first came in, could barely touch her foot. Because so hot and bothered and irritated, and you're in a boot and you're not walking normally and everything is guarded and protected, and as soon as we get our hands in there and start to move it, it can reject that touch almost right away. And even really light touch where I say not even enough to kill a fly, so tender. But over time, and that's again why exercise often is not enough. In this situation, this client, if she had just started to stretch and whatever, I don't think she'd be doing as well as she is now. But we get in there and we moving it and we go forward and forward and forward. And we're finally at a point where moving more, where a compression sock actually works. Before that, we needed to use just an ACE bandage to provide some extra compression. So that's the other situation, is compression socks or sleeves. Those kind of things can be helpful. But when you are really swollen, depending on how bad the situation is, you can't slide that over. You can't tolerate that very well at all. So again, the importance of icing, such a good reminder for all of us when things hurt. Doing exercises proactively, which is what we talked about last week, how much better it is to do the exercises than even just doing the icing or doing ibuprofen. If you can find an exercise that will reverse your symptoms, do that first. Figure out what that is. Now, it needs to give you long-term benefits. What do I mean by that? We often find, for example, let's say you have a bulging disc in your neck, you will temporarily feel better by bringing your head forward. We talked about this last week, where you're going to take pressure off that disc, but it actually makes you worse long term. But if you can find an exercise that brings your pain back down and keeps it down, that's your go-to exercise. And that's what we're always trying to figure out in therapy, which is one of the most valuable questions we will ask you regularly. And if you're going to come to therapy, you should know the answer to this. What makes it worse and what makes it better? Because if nothing makes it worse or better, it's not musculoskeletal. And that lets us know that you have a kidney issue or something else. It's part of our differential diagnosis. But I'm looking even for variations in that pain. So someone will come and say, it hurts all the time. What makes it better? Nothing makes it better. What makes it worse? No, it's always bad. Well, when we start peeling that back a little bit, it might still always be at a 6 or a 7 or an 8, and you're in a lot of pain. But when I bend over to put my shoes on, it goes to a 9. But when I lay on my back on the floor, it goes down to a 6. And so really important to know that variation in pain helps us identify the cause of your symptoms. It's why, as physical therapists, we often don't need an MRI or a CAT scan or an X-ray to figure out what's going on with you, because the body is logical. God made the most amazing machine that makes a lot of sense. And when you can describe those activities that make something worse or better, we can get to the, sorry, I'm getting beeps. We can get to what's worse or better much faster through the information that you tell us. It makes me think once my sister said to me, don't ask Melissa what's wrong with you. She'll ask you 100 questions, which is true. But since my crystal ball broke yesterday, I can't just figure out what's going on. But you actually know what's going on with your body way better than we do. You just got to pay attention. And when you're in the middle of a pain cycle, you're not feeling well, sometimes you can't see the forest from the trees. You're so stuck in what's going on. Like, I just hurt all the time. Well, may not be true. We really hope that that's not true. And we're trying to figure out why, what, how long. Describe that pain. Very beneficial. And like I said earlier, sadly, as physical therapists, I feel like God allows us to go through different pains, or at least me, so that I can go, oh, I know what that is. I've had that before. That's nerve pain, even though it's deep in your arm and is aching, not numbness and tingling. So all those different things to consider. So good questions, Jen. Appreciate your comments as well. Renee's question, Philip's question. Let's see, what time are we at? Oh, look at that. It's 7:40 Eastern time. Anybody else have a question they want to ask? I've got one thing I'm gonna end on, but I certainly don't have anywhere to go right now. I will add that when you decide to do Facebook videos in your fancy corner office in your bedroom, it makes you clean your bedroom. So picked up all the clothes from the week. So there's a positive in everything. Oh, so good. All right, anybody else? Any other questions for those of you who are out there? All right, let me get one drink here. All right, final thoughts by Melissa. Here we go. So I was talking to one of our clients this week who works in the health industry and really in making people healthy. And as we've been talking with each other about how we take care of ourselves, we've had some great discussions about the importance of mental health, how to lean into those issues that are blocking us from moving forward in whatever area of life is. I know that when I'm stressed, I want to eat ice cream. It's a horrible trigger. Or when I go to sit on the couch, if I've had a pretty lazy winter, automatically I need something sweet, which I don't think I really crave it. Anyway, bad habits, those kind of things. And so in that context, we're talking about all those different things, and we're talking about what's happening in the world right now. And the sad fact that, yes, people are getting sick. I read an article where it appeared that the people who have died in our county and Ottawa County were all in their 70s and all had other health issues. And I always go, is it the right time to start talking about the future, or are we still so ingrained in our present state that we have to stay focused on surviving and we can't start thinking ahead about what thriving looks like? But as I've been thinking about what the future might start to look like, and as I pray things start to look normal, it made me really think about the importance of being able to move without pain. So if you think about the people who sadly are getting sick or hospitalized, the information that I'm reading is that these are people who have high blood pressure, which connects to heart conditions. They're diabetics. They have COPD. They have pulmonary issues. They have all of these different health-related issues. Now, do I know all of their histories? No. My grandpa had really horrible asthma, but he was born very premature, so it fit with his history. But a lot of our health issues in our country are preventable, right? Type 2 diabetes is preventable through healthy eating and exercise and moving. We can manage our blood pressure by watching our diet. We can do all of these things. And one piece that I've been thinking about as a physical therapist is one of the keys to good health is moving. I'm seeing friends and family taking advantage of this downtime right now to go for more walks, and they're hiking and kayaking, and they're doing yoga, and they're doing all these great things, and they're hurting less because they're moving more. And so if anything good can come out of that is we realize the more we move and move well, the better we feel. So if we're unable to move, and that's where we come in, that's where I want to jump right into people's lives. If you can't move because your back hurts, your hip hurts, your knee hurts, and no, you didn't have some traumatic injury, you didn't fall out of a tree, you didn't get hit by a bus, you didn't have a sports injury, you didn't do anything, it just started to hurt over time, let's get to that earlier, because the longer we hurt, the longer we stop moving. The longer we stop moving, the less we manage our weight and our blood pressure and our cholesterol and our diabetes and all of these things. So I believe that this is such a great time for the message that moving matters. Moving on the list of sunshine and water and vegetables and fruit and sleep, nutrition, all of those things, right? All that stuff is really, really important. If you can't move and you can't move well, you need to know that there's hope for you and we can help. Rhonda said, call us, text us, send us a message. That's what we're here to do during any of these times. So keep that in mind. Jen's asking if we're open during these times. Kind of. That's the answer right now. We're taking care of those who really need it. We're taking it week to week. I'm telling you, I thought I was going to be seeing 3 people. That's what we started out with 4 weeks ago. I now have 10 people on the schedule that I'm seeing twice a week. And if it keeps going, we'll keep going. We'll figure it out week by week. We're taking care of the people who need it. And if people are not comfortable, I totally respect that. But the other thing I would say, since you asked and since Rhonda posted it there, if it's not something that's dramatically affecting your life right now and you want to stay safe and at home and minimize risk, I totally get that, right? Primarily, I'm taking care of the people who can't walk, had surgery, had vertigo so bad they needed a walker, all of those things. But I would say call us now, get on the list so that as soon as this craziness is lifted and we are free to go, we can reach out to you right away. And so that's something Rhonda and I actually were talking about this week. Like, what happens when we can go back to normal? Well, we want to reach out to the people who need the help. So if you want to get on that list, email the office, which is info@nephewpt.com. You can message us here on Facebook. Call the office. When you call the office, you'll also have access to our texting. If you're a texter, we do have a separate number just for texting because sometimes that's easier as well. So you got all these different ways to get a hold of us. But the message to walk away with is we can have hope that we're going to come out of this crisis, this pandemic. And I have hope that pain is not normal. I have hope that God made a body that allows us to improve it, to heal, to stretch it. Because remember, you guys, pain is not normal. See you next week.